That's such an important question and one that is so relevant for adolescent and young adult patients. I think a lot of it depends on your relationship to that workplace or your school and what you're willing to share about your diagnosis. Some patients may feel a little more privacy is better, in which case I'd encourage you to reach out to your healthcare team and request a letter to kind of say, vaguely what may be going on and what sort of accommodations might be needed. For those patients that feel a little more comfortable sharing and perhaps even leveraging support networks from those locations, I think going to your direct supervisor, if you're comfortable with them, is a good first step to talk about what may be going on, what you're expecting, and what kind of accommodations you think you might need. Again, such an important question because treatment-related symptomatic adverse events or side effects of treatment can be more burdensome, especially than young people are used to expecting when typically things come their way and they just keep floating on. Some symptomatic adverse events have interventions that can help. So certainly be in touch with your care team if you're experiencing anything that's substantially affecting you. Some things like nausea, we have lots of tools to help affect that, more than what you are probably getting already, that can be added to control that symptom. And then there are symptomatic adverse events that maybe we don't have a medication or a strategy to help, where you might need an accommodation. So fatigue is one of those. It's difficult to predict, and the burden of fatigue that a patient bears has a lot to do with their own individual response to chemo and the type of work or school they do and what's asked of them. And so I think it's very important to listen to your own body and talk to your healthcare team if you feel like you need some support or any type of accommodations. It really depends on the person and the type of treatment. But I think for many patients, it is helpful to have a reduced workload, or better yet, some flexibility. For some patients, if they work or go to school in an in-person setting, maybe the opportunity to do so from home would be more beneficial, and both from an infection prevention standpoint, but also from the standpoint of I can take breaks more freely if needed. So be in touch with your healthcare team if you think you may need any of those accommodations. I think also, if you feel comfortable sharing, what you're going through, people will be very supportive if you need to take fully time off or partially time off. Well, the Lymphoma Research Foundation has a lot of really beneficial resources for patients, including patient education materials and a helpline where you can even connect with someone who can help you navigate this diagnosis and the plan going forth. In addition to that, your healthcare team at your treatment center likely has a variety of different resources available to you at the place where you're receiving your treatment. So don't forget to ask your physician and provider or nurse about what's available to support you during this time.